So next we're going to talk about rotations, and I really treat rotations and pubic shears almost identically with muscle energy. And so with a posterior rotation, what you've got is the whole innominate rotating posteriorly. And so what that's going to do is bring the leg up, ASIS, may kind of rise, will definitely kind of go up a little bit. Crest should be the same. There's no change in orientation of crest. It's just kind of moving the PSIS back and the ASIS up. And so what you've got to use is you've got to use muscles anteriorly to kind of pull that back. And so what I generally do is have the patient slide over to the edge of the table, and I'll generally have them hang one leg off. And of course, motion, you can kind of follow where you're at here, and put my hand here, create a counter force, have the patient lift up and toward the table. Okay, that will create that force, will correct that posterior rotation. Okay, you slide back over. You again go all the way down, to the end and keep taking up slack, and again treating that. If you have an anterior rotation, again I treat it the same way that I treat a posterior pubes. I'm going to use the muscles posteriorly to correct that muscle injury. So I'm going to actually motion test here, bring it up to my barrier, kind of lean back, and try not to create too much pressure here, because that can be tender for some patients, and have them push their knee towards you or toward the table, and again tighten those areas up, correcting that. And again, take a big deep breath, which is essential to muscle energy, to get that complete relaxation between cycles. As they relax, you again take up slack until you find that barrier again, and so you go all the way down until you corrected that. That's basically how I treat innominate rotations and pubic shears with muscle energy, which are quick and easy and generally work pretty well, and don't cause the patient a lot of discomfort or pain.